The most dangerous blood pressure at your age is not always a high one. Sometimes, it's the one you've been told is perfect. Because the blood pressure target many people obsess over was never really designed around a 70-year-old body. It was built around averages, guidelines, and broad populations. And if you are in your 70s, pushing for a number that looks ideal on paper may not always be the thing that keeps you safest in real life. In some cases, it can do the opposite. I'm Dr. Elias Novak, and I want to show you why this matters so much, what changes in the body after 70, and what blood pressure target often makes more sense at your age. And if you're over 70, already taking blood pressure tablets, or being told your numbers need to come down even further, then stay with me, because this conversation may be far more important than you realize. Most people think blood pressure is simple. If it's high, that's dangerous. If it's lower, that's better. End of story. And when you're younger, that's often close enough to the truth. But once you get into your 70s, and certainly as you move beyond that, blood pressure stops being simple. Because now we are not just dealing with a number, we are dealing with circulation, balance, medication tolerance, stiffness in the arteries, hydration, kidney function, falls risk, and how quickly your body can adapt when you stand up, turn, bend, or even step out of a hot shower. That is a very different situation from a healthy 45-year-old. The problem is that medicine loves neat targets. It loves cutoffs. It loves tidy rules. It loves the comfort of saying this number is good and that number is bad. But older bodies are rarely tidy. Two people can have exactly the same blood pressure reading, and for one of them, that reading may be protective. For the other, it may be the reason they feel washed out, wobbly, foggy, or one misstep away from a serious fall. And that is the part people are not told often enough. As we age, our blood vessels change. They become stiffer, less elastic, less responsive. When you're younger, your circulation is like a new, flexible hose. It adjusts quickly. Pressure goes up, pressure goes down, and the system adapts. But as the years go by, the system loses some of that flexibility. It becomes more like an older hose that has hardened with time. It still works, but it does not react as smoothly or as quickly as it used to. And that matters for two reasons. First, stiffer arteries can naturally push the blood pressure number higher over time. That part is real. But second, and this is the part that matters just as much, your body becomes worse at adjusting your blood pressure moment to moment, especially when you stand up, especially when you are dehydrated, especially when you have not eaten much, especially when the room is hot, especially when you are ill, and especially when medication pushes your pressure lower than your body can comfortably handle. You may already know exactly what I mean. You get out of bed, and for a few seconds you feel strange. You stand up from the sofa, and your vision goes a little dim around the edges. You bend down, stand back up, and feel that wave of lightheadedness. You come out of a hot shower and suddenly feel unsteady. You walk into the kitchen feeling normal, and then for a moment it feels as if your body has not caught up with you. That is not you imagining things. That is often your blood pressure regulation struggling to respond quickly enough. The medical term for this is orthostatic hypotension, sometimes called postural hypotension. What it means in plain English is that when your position changes, your blood pressure drops in a way your body does not correct quickly enough, and your brain gets less blood for those few seconds. When you are younger, that might just mean grabbing a doorframe and laughing it off. When you are older, that can mean a fall. And a fall in later life is not a small event. A fall can mean a fractured wrist, a broken hip, a head injury, an ambulance, time in hospital, weeks of reduced confidence, months of lost mobility, and sometimes the beginning of a completely different life. That is why this topic matters so much. Because yes, high blood pressure does increase the long-term risk of stroke, heart attack, kidney disease, and heart failure. Absolutely, that part is true. But what is also true is this. In some older adults, overtreating blood pressure can become more dangerous than the blood pressure itself. And that is not said nearly often enough. Let me explain it with the kind of example I see versions of all the time. Imagine a man in his late 70s. He still drives, he's independent, he goes out, he's mentally sharp, he takes care of himself. Maybe he plays golf, maybe he gardens, maybe he walks every morning and still has a strong sense of who he is. His blood pressure is running high. Let's say the top number is sitting in the 160s or 170s. Now on paper, that is a risk. And in the right person, lowering that pressure may well reduce the chance of stroke over the coming years. So treatment begins. And then something happens that the guideline does not feel. He starts feeling weak, dizzy, unsteady, not dramatically ill, just not right. He gets up too quickly and nearly goes over. He starts avoiding walks because he does not trust his balance. He feels washed out in the morning. Suddenly, the treatment that looked sensible on paper is changing how safely he can live his life. And that is the blind spot, because the same tablet at the same dose can behave very differently in a 45-year-old body and a 75-year-old one. Age changes the physiology. Frailty changes the physiology. Dehydration changes the physiology. Kidney function changes the physiology. Weight loss changes the physiology. Polypharmacy changes the physiology. And if you are taking several medications already, the margin for error becomes smaller. This is why two people who are both 70 can need completely different targets. One 70-year-old may be fit, active, walking 2 or 3 miles a day, eating well, thinking clearly, tolerating medication perfectly, and with many years of life ahead to benefit from good long-term blood pressure control. For that person, a lower target may make good sense. Another 70-year-old may technically be the same age, but be dealing with balance problems, weight loss, kidney issues, several medications, poor appetite, fatigue, and dizziness when standing. For that person, chasing an aggressively low number can be exactly the wrong move. Same age, different body, different risk, different target. And this is where so many people get misled, because they hear a blood pressure goal spoken as if it is universal, when in reality, it often depends on one very important question. How well does your body tolerate that number? That is the question that matters. Not just what the reading says, not just what the chart says, not just what the guideline says, but how that number is behaving inside your life. Are you steady on your feet? Are you thinking clearly? Are you getting dizzy when you stand? Are you falling? Are you exhausted after medication changes? Is your standing blood pressure dropping sharply even if your seated reading looks wonderful? Because once symptoms enter the picture, the conversation changes. Now, I want to be careful here. This is not me telling you that blood pressure treatment is bad. It isn't. For many people, it is absolutely the right thing to do. High blood pressure is often silent for years while it damages blood vessels in the background. That is why treatment has saved many lives. So I am not asking you to distrust treatment, and I am not asking you to distrust your doctor. What I am saying is something much more specific. At 70 and beyond, the goal is not to treat the number in isolation. The goal is to treat the person. So what should your blood pressure actually be at 70? Here is the honest answer. There is no single magical number that is right for every 70-year-old. Anyone who gives you one exact target without context is giving you a shortcut, not a full answer. But in broad terms, here is how I think about it. If you are in your 70s, generally fit, active, functioning well, and you are tolerating treatment without dizziness, weakness, or falls, then keeping the top number below around 140 often makes sense. And in some people, getting closer to the low 130s may be reasonable if it is well tolerated. That is the key phrase, if it is well tolerated. Not if it looks beautiful on paper, if it is well tolerated. But if lowering your blood pressure is making you feel faint, unsteady, foggy, weak, or if your pressure drops significantly when you stand, then your safest target may not be the lowest one. In that situation, your symptoms matter enormously. In fact, they may matter more than the seated reading. And once people get into their 80s, or if frailty becomes part of the picture, many clinicians become even more cautious, because now the price of overtreatment can be very high. Loss of balance, loss of confidence, loss of independence. That is why the best blood pressure target at 70 is not just a number. It is a number plus context, a number plus function, a number plus symptoms, a number plus standing blood pressure, a number plus how you actually feel living your life. And if nobody has looked at it that way with you before, that is exactly why this conversation matters. So if you are over 70 and on blood pressure medication, here is what I would want you to think about before your next appointment. Do you ever feel dizzy when you stand up? Do you ever feel worse after taking your tablets? Have you had near falls, actual falls, or moments where you suddenly needed to grab onto something? Do you feel most unsteady in the morning, after meals, after a shower, or in warm weather? Has anyone actually checked your blood pressure while you are standing, not just sitting? Because if the answer to that last question is no, then an important part of the picture may be missing. And when you speak to your doctor, be specific. Do not just say, "I feel a bit off." Say, "I've been feeling dizzy when I stand up." Say, "I feel unsteady after I take my blood pressure tablets." Say, "Can we check whether my target is still right for me at my age?" Say, "Can we check my standing blood pressure as well?" That is a very different conversation. And sometimes, it is the conversation that prevents a fall. There is one more thing people often overlook. Even when someone does need treatment, the question is not just whether the blood pressure is too high. It is also whether they are on the right medicine, at the right dose, at the right time of day, in the context of everything else they are taking. Because as you get older, certain side effects become more common. Swollen ankles, dehydration, kidney strain, fatigue, electrolyte problems, extra trips to the toilet. And sometimes what looks like just getting older is actually a medication issue hiding in plain sight. That is why this should never be reduced to a simple message of lower is always better. At 70, smarter is better. Safer is better. More individualized is better. And if there is one message I want you to take away from this, it is this. The right blood pressure target at your age is the one that protects your heart and brain without making you more likely to fall, faint, or lose your independence. That is the balance. That is the real target. So please, if you are taking blood pressure medication, do not stop it on your own after hearing this. But do take this seriously enough to start the right conversation. Because sometimes the number that looks impressive on a chart is not the number your body is happiest living with. And sometimes the safest target for a 70-year-old is not the one originally designed with a younger body in mind. I'm Dr. Elias Novak. If this helped you, then the next thing to look at is not just your target, but whether you are on the right tablet in the first place. Because in older adults, the wrong medication can mimic aging, weakness, and balance problems far more often than people realize. And once you understand that, you start making much better decisions about your health. Take care,